Requires that we're a little closer together. I will pay the extra money and buy you a seat up here, but please get up right now and move to the front. Please.
มานั่งข้างหน้าเพราะว่าจะได้เห็นกันใกล้ๆจะรับรองผมไม่ harass พวกอยู่หรอกครับเชิญมาฮะเชิญมาฮะมานั่งข้างหน้าครับ
All right. Close as you can get.
Please.
Front row.
Please ภาษาไทยว่าไง
Please.
Yeah, please.
Please.
Not many professors in US call please. See this session for you. So come close, come close.
So you're going to work with Wanpen.
You just sit. I'll work with her and then call. It's time for you. Take a break.
I'm going to introduce you both.
Yeah. Go ahead.
So I'm going to get out of the way, and you've already been introduced to both of these individuals, Dr. Wanpen Vongpatanasin and Dr. Somkid. So you know them well, but I'd like to emphasize a couple of things. The first thing is Wanpen was sitting in your seat, as best we can figure out, about 1990 or 91. The very first time that this review was held. The review was originally established as a dream and a vision from Somkid Sridraman. Wanpen that year scored the highest score on the FM gyms from anybody in Thailand. So that was a success, but it's even more of a success. And again, you have already heard her introduction, but I want to emphasize this. She is an associate professor at University of Texas Southwestern Medical School in Dallas. UT Southwestern is one of the world's premier research institutions. She was able to land a position to train there, has become a part of the faculty there, is advancing through the ranks on the faculty there. And as an example, she holds right now as principal investigator an NIH grant, a grant from the National Institutes of Health. Those are extremely competitive. Only about 10% of all of those grants are awarded to somebody. She's got one. And so you could be in that same position one of these days. So she has not only done what you want to do, but now she's on the other end. So she has interviewed people who want positions. She has a lot to explain to you. So please listen to these two individuals, and I hope you will find it helpful.
Thanks again for the kind introduction. So the format this evening, we're going to do just a little bit of about 20 minutes of lecture, and then I'm going to ask the faculty to add in terms of how to prepare for an interview. And then we're going to have a mock interview. So I'm going to pretend I'm an interviewee, and Dr. Dosit, Paul Dosit here will be interviewing me. And then we're going to pick one of the people in the audience to be interviewed. I think it's a great opportunity because the thing is, even a medical student in the United States, they have to do a mock interview and have someone critique you, how you react, because you can go listen to that and this, you know all the rule, but when you actually go in the situation, you forgot all that and you just do all the wrong thing. So, but anyway, I just want to give my take on this. Obviously, there's nothing absolutely right or wrong. It's not like a USMLE question that we went through. But I think majority of us will agree upon what I have. Anyway, so before we started, we need to know that there's a lot of things that is a negative perception against us. So some of it is true and some of it is not. So if you know ahead of time, you try to minimize the negative perception and try to make the anxiety or this negative perception to go away. So obviously, some of it will be a difficulty with medical and non-medical English. So medically, actually, our medical English is pretty good because we already learned it from textbook in English. But the non-medical English is something that we always struggle with, and people have, either have to go through additional. Most of the people I've recommended to go through additional English course, either a classroom or, if best, is a one-on-one with the American or someone who speaks English proficiently. They are afraid of medical education, and I think that I'm very confident that whatever you know is very similar to U.S. medical graduate, if not more. So you shouldn't be not confident about that part. Particularly you already gone through this course. And a lot of times, sometimes people who graduate from medical school for a long time, and if they apply late, particularly if they're doing research or other things that have no contact with patient, that may create some fear or afraid that they'll be rusty in clinical performance. Usually it's not the problem of us, because we usually don't do research here for a long time before we go there. Cultural difference in beliefs about communications. Obviously, when you come from a different culture, there could be anxious whether you have different beliefs that in terms of communication, authority, gender roles, or the role of physician. I think that most of our culture are very flexible. We're not too rigid about particular religion or authority or gender roles. I think that if we can show at least that we are flexible in terms of beliefs, I think that most of the time it's not the problem that we have. So overall, how will you be judged? So the first thing is the record, because they usually don't know anything about medical school in Thailand. So the USMLE score is the thing that they look at the most. So that's why you have to take this course, because if you score 70, not likely you're going to know a whole lot. And most of the time you need to score, if you want to get into a good program, at least 90 in both parts. If you could, it will be very helpful. The class rank, like if you rank in the number 3 of your class or the top 10%, that helps. That will come out from your transcript, I guess. Any kind of honors and award, that will be helpful. And they can judge it from the quality of reference letter. I can go through a little bit more afterwards. And the past research, if you have an opportunity to do research, not just presentation, if you even have better is publication, even a local Thai medical journal here, it's still better than nothing. General appearance, physical appearance, I think usually you use common sense when you dress up, pretty conservatively. That should be fine. And they judge you by the character when you show up for an interview in terms of reliability, honesty, integrity. We'll go through that a little bit more later. Timeliness, usually, if you show up late, obviously that's a bad sign. Usually, if you prepare everything ahead of time, you should be able to show up in time. And you should know whatever specialty you desire to get in. Obviously, you're not going to know like people who already finished training, but at least you should know a little bit more compared to other specialty that you're not interested in. And you'll be judged for your intellect based on mental ability in general and communication ability. And the emotion part is work ethic. That's like how you need to be able to show that you're willing to work hard in all conditions to finish the training. And if you have some outside interests, I think they're kind of like that. If you have some other hobbies, you're good in playing piano or whatever, it just shows you that you're not just one-dimensional kind of people. And self-confidence is very, very important. That's particularly during interview. And first of all, before we go into actual interview, I think just going to mention a little bit about preparing a personal statement. So it should be clear and concise. Just fit in one page. There's no point going on and on and on. Most of the time, the faculty are already busy with teaching or seeing patients. They don't have time to read a lot of stuff. So if you try to write a clear and concise statement, 1 to 3 paragraph, at 3 at most. Avoid, as I talked earlier, the powerful language is to use the least amount of sentence to communicate your what you want to say. Don't just use big words and go on and on and on. Sometimes we think that it's a better English. It's not. Less is more. And try to communicate in a sincere way and reflect your motivation and inspiration. Why do you want to be a physician? Why do you want to choose that specialty? If you have a personal story, such as your relative was sick with the type of disease in the specialty you're interested in, or you have exposed to seeing patients in that area and you're fascinated by that specialty, whatever your personal story, because you don't want to make it sound like 100,000 other people. Make your own story. And also very, very important, so as we talk about the negative perception against you is your proficiency in English. So when you write this, avoid grammatical and spelling error at all costs. So when you write it out, have someone, if you could, who has lived in the U.S. and proficient in English, if you can't find anyone who lives in the United States, at least someone who is proficient in English to read it, see if it sounds, is it correct or sounds funny or not. In terms of reference letter, a lot of times I actually suffer a little bit from that because sometimes the way the faculty, I don't want to make it sound negative, but sometimes if the faculty who writes you a letter here doesn't know what the ideal letters are, usually the letters that, well, at least when I got it, it's very short and it doesn't have anything that personalized to me. It is not likely to, they will think that, well, she's not really that good. So because I can tell you that letters from other applicants are, they're 100% inflated in terms of good. You have to read between the lines. There's a difference between quality of the reference letter. So the ideal one, if you could, that is if the one who writes you a letter know the program director and the person who writes you a letter are a nationally recognized figure in the specialty you apply for, which is probably not likely to happen here, but at least if you can find someone who has had worked with you, not just know you that you're a student, has worked with you and think that you're doing really well, you're a brilliant student, that will be the good person who will write you a letter. Not just prominent people in the specialty, but they have to work with you so that they can tell all the details about why are you a good applicant. And if you can't find faculty or the letters from the faculty in the specialty you apply for, at least other faculty in other division who has supervised you, even though it's different specialty, is fine, but at least most of them should be in the specialty you apply for, who has gone through the training in the United States, if they could, because they will know exactly what I'm talking about. They need to, when you ask someone to write you a letter, you need to give them all the information, all the CV, transcript, personal statements, so they'll know what qualification do you have, so they can write it out, spell it out in the letter. So usually the reference letter should say that how long did they know you, what type of contact are they attending on your ward, and if they can tell specific incident, interaction they have with you, like during a workup of a patient, you find out something that no one find out, you just find it on history of interviewing the patient, or you come up with diagnosis no one else think of, or you go out and always read something extra, and then you assign duty, something like that they can make you stand out. And they also should say about what's the rank in your class. Are you a top 2%, 5%, 10%? What are your honors and award? Medical abilities, what's your ability to interact with patients, ability to solve the problem or put the data together? What's your skill in terms of physical examination, technical skill, if they have supervised you doing a procedure, are you able to present the case with clarity, or just if you can, all over the place, but obviously they don't want to say anything negative, but do you know medical literature extensively in the area that you want to apply? And also personal character, other than your medical abilities, what's your like personally? Are you able to get along with friends, the resident nursing staff, faculty really well? Are you able to communicate clearly? Are you dependable and reliable? And overall, what's the impression of the student? Sometimes people rate that, oh, this is the best student I ever worked with. If they can say that, that actually helps too. And in terms of CV, or the same thing as resume here, they call it more CV in the United States. So you want to, again, make it clear, concise, and accurate, no more than 2 pages, unless you have done research for a lot, which usually we wouldn't have that kind of qualification. And emphasize your strength, make it look clean and easy to read. Usually they already know that they're looking at CV, so there's no point putting a CV on top of your document. Avoid poor organization, poor grammar, misspelling, very, very important. You don't want to keep having a misspelling in your record. Try to make it narrative rather than outline. This is not a personal statement, so you're not going to write it as a sentence, I do this, I do that. You just have to make it just phrases. And try to avoid unexplained time period. They will say, so you say, well, from 1995 to 2000 you do this, and then the next one is 2005. So what happened between 2000 to 2005? You just quit school, or try to make it continuously. And so this is an example of one of the CV that is applicant for residency. I just wiped out the name. So they have a place of birth, date of birth, citizenship, and all this usual contact. Career goal, objective is optional. You can leave it out, that's okay. But educational qualification, this person graduated from medical school in Pakistan. They got an MBBS, they don't have an MD like us, but similar. And then he said he graduated in the top 2% of the class. And then I think that's a good thing to put, because you have to have a score as something they look out first. So you can put in, and this guy is very good, 99% both this is a real CV. And then past CSA. He lists professional experience. He did 3 months externship in cardiology with honors, and he did another 6 months internship in Pakistan. And then he's kind of lucky to get into research. You're competing with, a lot of times, these people have green cards, so they have no time limitation. They can do research first and then go in. So that's a little hard. But this, I think he has a green card. So he already did research in St. Louis. He's doing it right now. He listed the name of the PI in a project he's doing. And then he has some abstract presentation with his mentor. And he listed the volunteer work he did previously in Pakistan during a time he was a medical student. And that's it, that's 2 pages. So now going to the interview part. Before the interview, you should do a little homework, like we talked about, practice a mock interview, because of even the US medical student practice it. And try to do it with the English teacher or professor or whoever who has experience dealing with Americans, to know what the culture is. And when you try to visit the program, when you actually get invitation to visit the program, try to go to a program you really, really like on the middle or the last, because by that time you should be more fluent in English and know how it works. And also the last interview, usually I'll remember the best. Like the number one people who come, sometimes I can't remember what they like, but anyway. So that's something you can think about. You can try the program you're not sure you would like to go in first, and then, the one that you like the most in the middle or the last. And these are the type of questions that generally are asked during the interview. Tell me about yourself. So you should be able to think about what have you done. If you already finished medical school, what have you done since then? And they might ask you to. That way they can know how much you know and how much skills you have had. Why do you want to study in the United States? Everyone will have their own answer. Why do you choose this specialty? This one you can re-emphasize your personal motivation and inspiration a little bit more. What's your future goal? How do you see yourself in the next 10 years? What's make you unique? Sometimes they may not ask, but it could be a question. What makes you different from 10 other people or 10 other foreign medical graduates? And this is maybe a little less likely to ask, what have you accomplished inside or outside medical field? Sometimes they might ask you to describe your strengths and weaknesses. You can describe the strength, obviously without too much bragging, but just state the facts. And when you talk about weaknesses, you might state something that it's likely to be the strength, but it sounds like a weaknesses, but it's more likely your strength. Like sometimes you really want to work hard and you don't have much time to, have to relax or something like that. But anyway, you have to try to think about what could be your weakness that is not really a bad thing. If you could no longer be a physician, what career would you choose? Actually, I was asked this kind of question too. So they want to know what your outside interests. So you might be interested in art, and it's like, I could be an engineer or something else, or I could be an architect because I like art. What were the major deficiency in your medical school training? Why do you want to go to the United States? The same thing, but you don't want to make it sound like turn negative against your own school. Obviously, that doesn't look good on you, but it makes you obviously you want to say something like this: more advanced training, more research opportunity, along those lines. And again, what subspecialty? We already talked about this. Tell me about the patient whom you learn the most. Sometimes that's another way to assess how much you know in the specialty. You might want to think about difficult patient that's with the unique diagnosis, and sometimes you come up with that, or you learn and you read a little bit more. You have at least involved in that management. What's the healthcare system in Thailand? That's also another potential question. So you have to think about some of the words is not a medical term, and you have to find out the correct way to say it. And you might want to jot something, write something down, and so that you remember how to say it. What do you think? Sometimes it could be a funny question, like, what do you think is happening in politics or economy of Thailand? Maybe it's helpful to read English, the newspaper like Bangkok Post or something like that, to be familiar with the term, outside medical term. And I have one applicant who, she finished medical school and she served in the military, I think in the army, and they asked her to describe that experience. She couldn't say anything because she doesn't know the rank in army in English. So it turned out to be kind of negative because she couldn't say anything and she doesn't know how to say that in English. So I think that could be a negative. Whatever you've done, if it's something unique, you need to find out how to say in English. That's very important. So during the interview, first of all, you need to know your homework. You need to know how to pronounce the interviewer's name. Sometimes it's not a common. A lot of faculty are Indian or has unusual name. If you don't know how to say it, ask the day when you arrive. Ask the resident coordinator or secretary. How do you say that? Do some homework. And when you introduce yourself, I think it's better to say, hi, Dr. Smith. I am John Doe. I think they already know you're a doctor or not. It seems like if you say I'm a doctor, so it's like, you kind of, okay, I'm a doctor, you're a doctor, and what do you mean? But anyway, I'm one of the applicants. It's a pleasure to meet you. That's a generic way to say it. And give a right nonverbal signal. A strong handshake is important. So that's communicate your sincereness. So try to have a good grip. Maintain eye contact when you talk to someone. Our culture is a little different. We are more, we usually pay respect to the faculty. But if you're just trying to do this all the time, you're trying to hide something, or you're bored, you're just looking around, that's not a good thing. Maintain eye contact. Don't glance around the room, that's the same thing. Try not to, some people when they're nervous, they're just tapping the leg and all this stuff. No, that's not a good thing. Don't be intimidated, act with confidence. That's a very important part. I think that's one of the part that a Thai applicant, sometimes they are intimidated by the whole process, and that can be negative image. Smile often, that's usually not our problem. We usually have no problem smiling. Communicate with energy and drive. Initially you sit forward, but after that you can be relaxed a little bit, but not slouching or, in a bad posture. So during the interview, other things that we usually lack, don't try to, if you have an area that you're enthusiastic about, you can try to find a way, try to find an appropriate moment to bring it up. Try to initiate conversation, not just ภาษาไทยเรียกถามคำตอบคำเป็นไงโอเคอย่างเงี้ยคือ try to come up if you have something you want to say, find the right moment, not just interrupting them, but at least trying to bring it up, okay, I've done this, I've volunteered to do this, or something unique about you. Try to bring it up. Don't make them bore. Question they will ask you to, after you've gone through, if you answer them all this, they will ask you, what do you want to ask? So there's some good question you should ask, and there's some question you should avoid. So something like, is there an opportunity to do research during residency? Is there elective opportunities at other hospital or other city? Or is there a mentor advisor system? Usually now each program, usually they assign you a mentor during the first year to make sure you're doing okay, and if there's a problem, you can ask advice from them. What type of resident evaluation are used, and how often do you anticipate changes in the program in the near future? That's a generic question. Ask about availability of fellowship program. That's also not only a good question, but it's good for you that, as I talked about yesterday, sometimes when you apply for fellowship that's very competitive, like GI or cardiology, it's still difficult even if you start in a small medicine program. It will be, so if they don't offer fellowship, you have to start over again, apply, so that being an FMG is still a negative image against you, even though you do some residency there already. So if you can go into a program that have fellowship, the faculty will already know you because you start rotation there, so you're more likely to get in, at least in that program. So I think that asking about availability of fellowship is important. Don't ask about vacation or time off. Am I going to be working really hard? What kind of benefit package? How much do I make? They probably can't even answer you. You talk to the coordinator or someone else. Ask about how do I compare to other applicants. You need to do your best. That's not your position to track how I look against other people. Don't show discouragement. It's the same thing as act confidence. Don't criticize. Sometimes they ask you what else you have interviewed. It's like you interview there and there. Don't criticize them because oh well, we go to another place. They probably criticize our program too. So you can't look good with that. Avoid inappropriate humor, particularly on politics, religion, or race. You never go well with that. Obviously, try not to drink coffee because you have to go to the bathroom, and that's probably not good. And smoke, chew gums, or bite nails, or interrupt the interviewer. So other consideration is when when you go there, you're going to interact with the resident too. This is when you can ask about a little bit different type of question. You want to ask, like, you get enough supervision on consultation with the faculty? Are they available when you have question or problem? What type of lectures do they have? Do you have time to attend it? So if you have lecture but you don't have time to attend it, that's no good. You don't learn anything. What type of clinical experience will you have? Will you have time to read? And you can ask about vacation from them. You can ask that from the resident, that's fine. They're usually not the one who judge you or give you assess the score. Is there adequate levels of nursing staff or support staff? Like I mentioned yesterday, some programs are very small, and you might have to wheel the patient to X-ray themselves, so you don't want to do too much scat work. What's the call schedule? That's appropriate to ask the other resident. What kind of patient will you see? So there's a different type of hospital in the United States. Some for the indigent care, like Chula Sirat, so you see a lot of indigent care, then usually you'll be able to make a lot of decision on what to do first when they're first admitted. And that's what we call autonomy. You learn from making a decision and making this mistake from it. But sometimes you're in a program that's totally private. Your attending is the one who makes decision, then that you don't learn a whole lot. And some program is good, at least they'll be there and discuss things together, but you want to have a good mix of private patient and indigent care. How many foreign medical graduates are in the program? That's usually a good indicator. If they don't have any at all, likelihood you're not going to get in because they're not going to take you. But if they have everyone is FMG, then it raises a red flag that maybe the U.S. graduate doesn't want to go there because there's a problem in the program. So that should be some, but nothing should not be nothing or should not be all of them. What's the program accreditation status? Some of the small programs get into trouble because the resident doesn't pass the board exam. So, that could be you don't want to get into that program. And other things, to be pleasant to everyone, including the secretary, coordinator, be helpful, try to introduce yourself by name. Usually if you're not doctor taking care of them, they really don't care you're a doctor or not. Usually I think that it's okay to say them John Doe, not Dr. John Doe. Consider yourself under observation the whole time you're there, because you never know who you run into. It might be another faculty, or they might not interview you, but you need to be acting pleasant. If you have time if they invite you to attend lunch or dinner, avoid eating something that was splattered over on your shirt. Don't talk with the food in your mouth. That's not good. Avoid drinking alcohol. Don't eat too much. You'll be too sleepy. Don't order the most expensive item because they think you're greedy. You never get out. Or try to avoid other things like toothpick and all that stuff. Yeah. Try to pass the bread and appetizer around so you have a good behavior. You passing bread down, not just eating yourself and keep it to yourself. Say thank you to the waiters and waiters who bring you food and drinks. In Thailand, the cultures are different. It's just it's nothing right or wrong. Here, usually we don't thank the waiter or the waitress, but there you usually should. Avoid eating too much onion and garlic. Anyway, you don't want to smell bad. Okay, so after you interview, then you should write down the strength and the weakness of each program. So how staff, what are the size, are they happy about the program? What's the call schedule? What's the patient volume? What's the level of independence? Do you have time to read? Time to attend conference? Is the faculty available to teach you? Available of subspecialty training? Who does the teaching? Sometimes the faculty is not available and the resident has to teach themselves. I'm not sure that can be all good. And the quality of the teaching conference and the medical center. Generally, if you could end up in a university-based program, it usually is better than a community-based program. And ranking the program, you have to list enough programs to make sure you match and try to rank your number one pick first. That's the only way you can try to get in. Don't say that, well, number one choice, they might not rank you first. True, they might not rank you first, but there's a chance that people who, they might not fill up if you don't rank them first, you never get in. And rank the weaker program later anyway, and I already talked about that. So I think what we'll do next is I'm going to introduce, have Dr. I'll have Dr. Sita Ramon add a little bit, and then we have a little mock interview afterwards.
เชิญเลยครับอย่าขี้อายเชิญเลยครับ
My name is Warwan. I have a question that how many medical schools, I'm not sure that you know or not, that Thai students have to apply to get to the interview?
I don't think there's a... Yes, I think that the more you can get, I think generally at least 7 or 8. You can do more if you could, but you know, 7 or 8, I think usually it's good, pretty good.
Go ahead. Any question? Come on. Please ask. Don't be too shy.
My name is Patama. I am currently be junior faculty at Family Medicine Department. From yesterday, you suggest to learn English by private, right?
That's my personal opinion. I think other people are doing it different ways. Yes.
I interest in this point because English is my struggle. And may you suggest how you organize your class?
Oh, what I did is I happen to know a American, and who he's not really a medical field, but I just have a conversation with him like once a week or twice a week in 1 hour kind of period, and then when I write a personal statement or a CV, I show it to him, and he helped me correct some of that, and then when I do an interview, I kind of give them an idea what it is, and then I do an interview with him, and he told me, it's like, you know, you need to do this and that and those, and so I think it's very helpful, that part.
My name is Nalumon Jirapanakorn. I have some questions to ask you. Do the program have a limitation of the age of the applicants?
No, they can't. It's the nice thing about American is they cannot exclude you by age, race, religion, or anything. So they cannot discriminate against you, even by your disability. They can't even ask how old you are. Anyway.
Okay, yeah. Thank you.
Yeah.
My name is Nipat. Could you suggest what about the trick to applying to any programs such as how can I say? Because I think most of us, we don't know well which university, which program or which hospital it is suitable for us. Do you have a trick or any suggestion for us?
Well, like I said, I think that trying to find university-based program and find the specialty that you want to get in and see if they offer that kind of specialty. And these days, very easy. You can Google and you can go by region too. If you want to be limited to a region, I limit myself in the south because I don't like cold weather. So it's these days internet. You probably best is to just apply to a lot, and then whatever you get interview, you do in homework ahead of time and see what kind of program is that.
So how many programs that we should apply?
I think there's no limitation, is it? I think the more you pay, more money, but I don't think there's a limitation.
Is it will look good or not if we just spread out 50,
no problem.
hundreds?
No
If you have
problems?
money, your energy to do it, you have time, no problem. Go for it.
No more than 15.
Oh, is that right? You can.
Huh?
No more than 15, is that right?
Excuse me, my name is Padung Tham. I am an intern at the Karasin Hospital.
Okay.
I have some question. Can you estimate how much the money I have to bring to the US?
Well, I'm not sure. A lot of that depends whether, say, if you interview in the city, you have a friend who lived there, then you stay with them, right? That save a lot of money already. It's hard to say because I did it a long time ago. So I mean, you have to factor in the airfare and the hotel and all that stuff. Some programs give you free hotel, some don't. Yeah. It's hard to say.
Can you mention them the book, the classic book that everybody should buy and study?
Oh, actually,
The yellow cover or something.
I forgot the
like-
name. Yeah, I forgot the name.
There's a book.
There's a book about
Yeah.
all this. There's a book about
I
all
think
this.
it should be in our library here because I already bought one. But this book is very good, exactly what she explained.
Yeah.
Okay, let's do some practice.
Okay. So maybe we have a share. Let's see. Maybe we have a set up. Yeah, we'll have a chair or something like that. Okay.
เอาตรงนี้แล้วก็ให้พอมานั่ง
Oh, okay, okay. So
If you will, imagine, by the way, I'm Paul Douthit. I will be here tomorrow and Friday. If you will, imagine that we are in Lubbock, Texas, and this is my office. And I'm interviewing today for one of our resident spots. Thank you.
knock knock.
Hi, how are you? I'm
Hi.
Paul Douthit.
Wanpen, Vongpatanasin. Okay, I guess I have to.
Wanpen, would you say your last name again
Okay.
for me?
Vongpatanasin.
Do you mind if I call you Dr. Wanpen?
Wanpen is
All right. Welcome today to the Department of Pediatrics here at Texas Tech University Health Sciences Center. It's nice to meet you, and I'd like to spend some time talking with you if I could.
Thank
Have
you
a
so
seat,
much.
please.
Thank you.
Wanpen, I understand you are from Thailand.
Yes.
Would you mind helping me understand a bit about your medical training?
So we are our medical school program. I guess I should put it here. Our 6 years program from the high school, so we don't have to do college separately 4 years from the medical school. So it's a 6 years program like the British system. So we have to go through an entrance examination, and the student choose the program they like, and then they go to the medical school they like. And after the medical school, we are required to serve the country for 3 years, and then go into the specialty training afterwards. If they can't complete 3 years, they have to pay back to the government. Okay.
So you finished your training, or you finished your obligation to your government,
Right.
and you're now seeking, you want to come here
Yes.
to our United States, and
Yes.
you would like to you'd like to become a pediatrician?
Yes, sir.
Very good. Tell me a bit, if you will, about the Thai health system.
Well, the poor, actually, the indigent care is covered by the government, but most of the people who can afford the healthcare system pay out the pocket. The insurance system are not well developed like United States. So most of the time it's the out of pocket type of pay, but I think the cost of the healthcare here is not as expensive as in United States. So most of the people who work usually can afford to some extent of their health care.
Good. It sounds like you know a little bit about our healthcare system here in this country as well, and that's good. Tell me, if you will, you're obviously here in the Department of Pediatrics interviewing, wanting to come and train with us. How long have you wanted to be a pediatrician?
Oh, since I was a medical student, I always amazed with the I would like to help children, and I love to take care of them, and I think I'm very good with. I actually lie right now. Anyway.
You're acting well.
I like to see them. I think it's very gratifying to see them recover from a major illness and be able to go back and grow up to be a normal adults and be a functional people in the society.
Well, and I should have said this in the beginning, but I want you to feel comfortable asking me questions at any time, either about the Department of Pediatrics, about the training, about the city of Lubbock. Have you ever been in Texas before?
No, I have not. It's the weather similar to. How hot is it in the summer?
Well, in Lubbock it can get quite hot, but it's a dry climate, so it's really not as bad as you might think.
Okay.
So now in the winter it can get pretty cold. We have snow, 2 or 3 times a year sometimes. It doesn't stay long, but it can get cold.
Okay. So in your program, is the resident have opportunity to do elective rotation within the university or outside the university?
You have some flexibility there, and it really depends on what your areas of interest are. And there's also obviously a set program that we have, and how that works within our set program. But you do have some opportunities and some flexibility. Okay. So you've wanted to be a pediatrician for a long time. I'm wondering what kinds of things about you that will help you to become a good pediatrician?
I think I'm energetic. Get along well with children. My father is also a pediatrician, and it kind of motivates me to be as good as he does, and eventually I also would like to be. Then I'm not doing too good because I didn't prepare for this kind of question. And then I would like to, I have ability to study hard, and I'd be willing to work hard and learn. And I think I can achieve those things and be a good pediatrician.
Very good, very good. Now, it sounds like you have some good qualities that will help you. What areas do you want to continue to strengthen?
Well, I think that probably will end up. I'd like to do pediatric cardiology because I like it's more procedural based, but it's still you still have ability to put the data together, put the history and physical examination, and couple with using the skills. I think it's the best one combined between thinking and doing procedures. So I think that's what I would like to pursue.
As you may be aware, we don't offer a fellowship in cardiology. Have you considered, once you complete your pediatric residency, where you might go then?
I have not made up my decision yet, but I think I'll probably have more ability to examine those issues when I enter the pediatric residency. Okay.
I'm curious, a few minutes ago you seemed to indicate that you had some knowledge about the healthcare system in the U.S. Do you have any ideas about how you might fix our system?
Probably not right now. I have to, but
can be fixed.
I think that's it. Yeah, I think that once I'm here a little bit more and understand the system a little bit more, maybe I can maybe have some more idea. But I think it's a problem that you have for a long time, so I don't think it's be easy to fix by one person. Yeah. Anyway, should we try to?
Yeah. Why don't we move from here? Any questions about what you observed?
I want to know how long does one of the interviewer have to be in the room. I don't know because my friend, he already took the exam and got the interview, and he said that it was like a dinner or something.
No, actual interview is only 20, 30 minutes. But there might be a dinner before that. There might be a dinner before that or afterwards.
30 minutes, 30 to 45 minutes.
Yeah. One by one, yep.
Yes.
So,
Any other questions?
is it too late? You guys want to be? You guys want to volunteer?
Do we have any volunteers? Do you want to do that,
Or you
or
want it to be adjourned? Or should
Okay.
quit?
เหนื่อยหรือยังหรือจะหยุดคืออย่างน้อยก็ได้เฟเวอร์ได้มีความรู้ของพวกนี้มันไม่หนักหน่วงอะไรหรอกเพราะว่าหนึ่งขอให้สอบได้แล้วก็ได้คะแนนสูง แล้วเพื่อจะไปตีนตวิวเนี่ยก็หารุ่นพี่มาเตรียม
To score high.
เอาเตรียม
yes, score.
Yeah,
That's
yes,
right.
yeah.
That's right.
ปัญหาเรื่องภาษาเนี่ยบางทีผมก็รับเรสซิเดนต์ไปอยู่กับคนไทยด้วยกันฝึกภาษาแล้วเวลาไปอยู่กับผมหรืออยู่กับใครก็ได้เขาจะหาคนไข้ให้ไปหัดอินเตอร์วิวหรือหัดพูดอะไรเงี้ยYou can do it now here in any part because we have tourists. See, you can be friendly. Said, I volunteer to take you for a tour, but in the meantime, may I learn English from you? Can I talk to you in English? I want to practice.
Watch American movies and then have a subtitle. Not,
Yes.
don't have subtitle in English. Speaking English, subtitle in English.
Right.
So you can see what they're speaking in what situation.
And listen, sometimes it's an English movie, but they have English accent. But don't watch cowboy movie.
Yeah. No.
Don't watch cowboy movie.
Might be
No
good
good.
for
Our
the
British
young.
movie. Don't watch
British
British
movie. But they also have some video, something that you can buy and borrow for English practice.
Watching TV.
Hello, how are
Yeah,
you?
I did
Good
that too.
morning.
Yeah, I watch lots of sitcoms.
Yes, it comes.
They always talk about weather. Weather.
Weather,
Yeah.
yes, weather.
Oh, beautiful today, sunny. You talk about weather. Talk about the town, talk about culture. Show them that, for example, if I go to Cleveland Clinic for interview, you talk about Cleveland Clinic. Oh, your football team won yesterday. They impressed because you study. But don't talk about when they lost. For example, you go to Boston, they just won the Super Bowl. Don't mention it. They'll be mad. So don't do some negative. Everything is common sense. It's common sense. Okay, any other question? Thank you. See you tomorrow.
That was an excellent presentation.
Oh, thank you.
Perfect.
Thank you.
Really helped.